I want to share with you a powerful real-life story that truly highlights how serious and misunderstood this issue can be. A family reached out after experiencing something that changed their lives. Their 82-year-old grandmother, Margaret, had always been sharp, independent, and full of energy. She read books every day, kept up with current events, and was the rock of the family. Then, almost overnight, something changed. Margaret became forgetful. She couldn't remember her grandson's name. She began wandering around the house at night, confused, asking the same questions over and over again. She was irritable, disoriented, and sometimes didn't recognize her own children. The family was devastated. They were certain this was the beginning of Alzheimer's, that the woman they loved was slipping away. They rushed her to a neurologist. But before they began any cognitive testing, the doctor ordered a simple urinalysis. The results? Margaret had a severe urinary tract infection. There were no complaints of pain, no fever, no burning, none of the classic signs you'd expect, just confusion, memory loss, and behavioral changes. The doctor prescribed antibiotics immediately, and within 72 hours, Margaret began returning to her normal self. Her memory started coming back. The fog lifted. She smiled again. She joked with her grandchildren, told stories from her childhood, and asked about the garden she'd neglected for days. The family couldn't believe it. What they thought was the tragic onset of dementia turned out to be a completely treatable infection. And the only reason they caught it was because one doctor knew to look beyond the obvious. This story isn't rare. It happens every single day. Seniors misdiagnosed, families terrified, when in reality, the issue could be resolved quickly, if only people knew what to watch for. So if you have an elderly loved one showing sudden signs of memory loss, confusion, or unusual behavior, don't panic. Don't jump to the worst-case scenario. Ask for a UTI test. It might just save their clarity, their independence, and quite possibly, their life. Did you know that one of the most common causes of sudden memory loss in seniors isn't Alzheimer's, but something much simpler and treatable? It's a condition that's often overlooked, yet it can have a profound impact on the cognitive health of our elderly loved ones. The shocking truth is that what might seem like the early signs of dementia could actually be caused by something far more manageable, something you might not even think of. It's easy to assume that memory loss, confusion, or even personality changes in seniors are simply due to Alzheimer's or another form of dementia. But what if I told you that there's a hidden health issue causing these very symptoms? And the best part is, it's treatable. In today's video, we're going to uncover a silent, yet incredibly common health problem that many doctors, caregivers, and even family members often miss. This issue could be the reason why your loved ones are suddenly forgetting things, acting confused, or becoming disoriented. And the best part? It's something that can be addressed with the right diagnosis and treatment. By the end of this video, you'll have a clearer understanding of what's really going on, and most importantly, how you can help prevent this condition from affecting those you care about. Stick with us as we break down the signs, symptoms, and crucial steps to take if you suspect this may be affecting your elderly family members. Trust me, you don't want to miss this. Have you noticed a senior in your life suddenly acting confused, forgetful, or disoriented? Maybe they've started misplacing things more often, repeating themselves, or even struggling to remember familiar names and faces. It's natural for your mind to jump to one conclusion: Alzheimer's. After all, we're constantly warned about the risks of dementia as we age. But what if I told you that those symptoms might not be what you think they are? Here's something that most people don't realize. Urinary tract infections, or UTIs, can actually mimic the symptoms of Alzheimer's and other forms of dementia in older adults. That's right. Something as seemingly minor as a bladder infection can lead to sudden and severe changes in behavior and memory. In seniors, UTIs often don't cause the usual signs like pain or burning. Instead, they show up as mental confusion, agitation, hallucinations, or even extreme fatigue. It can look terrifying, but it's not what it seems. And this is where the problem becomes urgent. Because UTIs are so often overlooked in seniors, especially when there are no physical symptoms, they can go untreated for far too long. And untreated UTIs don't just get worse, they can lead to kidney infections, long-term cognitive decline, and in severe cases, life-threatening complications. But here's the good news: with the right knowledge and early action, these outcomes are completely preventable. That's why this conversation is so important, because it's not just about awareness, it's about saving lives, restoring clarity, and giving our loved ones the care they truly need. A urinary tract infection, or UTI, is often thought of as a mild, uncomfortable condition. It happens when bacteria enter the urinary system, which includes the kidneys, bladder, ureters, and urethra. In younger adults, UTIs typically come with clear physical symptoms: pain or burning during urination, an urgent or frequent need to go to the bathroom, lower abdominal pressure, or cloudy urine. These are the red flags we've all been taught to recognize. But what happens when the symptoms aren't obvious? Here's where things take a dangerous turn, especially for seniors. In older adults, the body doesn't always respond to infections in predictable ways. As we age, our immune systems weaken, and the body's ability to localize symptoms starts to fade. So instead of the usual signs, a UTI in a senior might appear as something completely different, something far more frightening: sudden confusion, unusual forgetfulness, changes in behavior, irritability, or even full-blown delirium. These symptoms often mimic what we typically associate with Alzheimer's disease or dementia, and because of that, the real cause can easily be overlooked. Imagine this: your parent or grandparent is completely coherent one day, and the next, they can't remember your name. They're disoriented, repeating themselves, or struggling to complete basic tasks. You rush to the doctor fearing the worst: early onset dementia. But in many of these cases, what's really happening is a hidden infection that's quietly wreaking havoc on their body and brain. But why does this happen? Why would a simple infection in the bladder or urinary tract affect the brain so drastically? It all comes down to how the body responds to infection. In seniors, even a mild infection can trigger a systemic inflammatory response. This inflammation doesn't just stay in the urinary system, it can impact the brain, disrupting normal neural function. This condition, often referred to as infection-induced delirium, can lead to rapid and intense confusion. Unlike dementia, which progresses slowly over months or years, UTI-related cognitive changes can occur in just hours or days. This is your warning sign, and the statistics are truly eye-opening. Clinical studies have shown that over 60% of elderly patients diagnosed with UTIs experience some level of mental confusion or altered mental status. In some care facilities, this number can be even higher. Tragically, these symptoms are too often mistaken for permanent cognitive decline. Families are told their loved one has dementia, and the actual infection goes untreated for days, or even weeks. All the while, the person is suffering, needlessly. But here's the hopeful part: UTI-related memory loss is reversible. With a proper diagnosis and antibiotics, seniors who were once incoherent or confused can return to their normal, vibrant selves in a matter of days. We've seen countless stories of families brought to tears, not from grief, but from relief, when their loved one recovers fully after what seemed like a mental breakdown. That's why awareness is so crucial. Recognizing the signs of a hidden UTI could literally change the course of someone's life. It's not just about treating an infection, it's about reclaiming clarity, dignity, and connection for the people we love most. So how can you tell the difference between dementia and something as treatable as a urinary tract infection? This is one of the most important questions caregivers, family members, and even healthcare workers can ask, because the clues are there, if you know what to look for. First, let's talk about the key symptoms. One of the most obvious red flags is sudden mental confusion, especially if it comes out of nowhere. If your loved one was sharp, alert, and aware just a few days ago, and now they're forgetting names, mixing up places, or acting in ways that feel completely out of character, it's time to pause and consider the possibility of a UTI. Other early indicators can include increased irritability, restlessness, or even frequent and unexplained trips to the bathroom, all of which might be dismissed as just getting older, but often signal something deeper. Now here's what's truly critical to understand. The mental symptoms of a UTI look very different from something like Alzheimer's disease. Alzheimer's is typically slow and progressive. The decline happens over months or years. You may notice your loved one gradually forgetting small details, or having trouble with time and routine, but it's a slow unraveling. With a UTI, it's like flipping a switch. The confusion can begin in hours or days. Your loved one may suddenly not recognize familiar surroundings. They might forget where they are, or accuse others of stealing things that aren't missing. They may even hallucinate or become paranoid. This rapid onset is what separates infection-induced delirium from long-term cognitive decline, and it's what makes early recognition so vital. But the signs don't stop there. Let's look at some additional red flags that are easy to miss. Has your loved one experienced a sudden loss of interest in things they usually enjoy? Are they refusing to eat or drink, withdrawing socially, or appearing deeply fatigued without explanation? Do they seem especially disoriented at night, or have they started sleeping excessively during the day? These are all symptoms that something deeper is happening inside the body, and too often, these behaviors are blamed on aging or dementia when they're actually cries for help. You may also notice subtle physical cues, like a strong-smelling urine, incontinence when it's unusual for them, or unexplained shakiness. Sometimes, seniors won't feel or report pain in the way younger people do, so these indirect symptoms become even more important to catch. The bottom line is this: if there's a sudden change in how your loved one is thinking, speaking, or behaving, don't assume it's just aging or the start of something irreversible. Ask questions, dig deeper, and most importantly, request a simple UTI test. This single step could restore their clarity, their independence, and your peace of mind. Here's the good news: diagnosing a urinary tract infection is quick, non-invasive, and extremely effective. Unlike some complicated medical tests that take weeks or even months for results, identifying a UTI typically just requires a simple urine test. A doctor will analyze the urine sample for signs of bacteria, white blood cells, or other markers of infection. It takes just a few minutes to collect, and in many cases, results are available within hours. And if the test comes back positive, treatment is straightforward. A course of antibiotics is usually all it takes to begin clearing up the infection. In fact, many seniors begin to regain their mental clarity and return to normal functioning within just a couple of days. It's one of the rare cases in healthcare where something that looks like a major mental health crisis can be turned around almost instantly with the right diagnosis and treatment. But here's the flip side: waiting too long can be dangerous, even life-threatening. When left untreated, a simple UTI can travel up the urinary tract and spread to the kidneys, causing more severe infections and permanent damage. In the elderly, untreated UTIs can escalate to sepsis, a serious, body-wide infection that can be fatal if not caught in time. What's even more concerning is that the longer the brain is affected by the infection, the more damage can be done to mental function. Some seniors who go untreated for too long may suffer lasting cognitive impairment, even after the infection is gone. This is why early detection and treatment are absolutely essential. It's not just about clearing up an infection, it's about protecting the brain, preserving independence, and preventing a condition that's 100% treatable from turning into something that permanently alters the course of a person's life. So if someone you love suddenly seems confused, agitated, or mentally off, act fast. Don't assume it's dementia. Don't wait. Ask for a urine test. You might just catch the true cause in time to make a full and life-changing recovery. Now that you understand just how serious and silent UTIs can be in seniors, let's talk about how to prevent them before they start. Prevention is always better than treatment, and the steps are simple yet powerful. First and foremost, hydration is key. Many seniors don't feel thirsty as often, which leads to dehydration, a major risk factor for urinary tract infections. Encourage your loved ones to drink plenty of water throughout the day, even if they don't feel thirsty. Next, help them maintain good personal hygiene. This includes regular bathing, wiping front to back for women, and ensuring clean undergarments. If mobility is a challenge, caregivers should offer gentle, respectful assistance to keep everything clean and dry. Lastly, ensure that they're emptying their bladder regularly. Holding in urine for too long allows bacteria to multiply, increasing the chance of infection. But even with the best prevention, UTIs can still happen, and when they do, early detection can make all the difference. If you notice any signs of confusion, memory lapses, or behavioral changes, don't panic, but don't assume it's Alzheimer's either. One of the most compassionate things you can do is simply call a doctor and request a urine test. That one step could be the turning point between decline and recovery. Also, make sure your loved ones are getting regular medical checkups, especially as they age. These appointments aren't just for blood pressure and cholesterol, they're a powerful tool for monitoring urinary health, catching early warning signs, and preventing minor issues from turning into serious problems. Being proactive about health isn't just smart, it's life-changing. Let's recap what we've learned today. A sudden change in memory or personality in seniors isn't always a sign of dementia. Often it's something far more treatable, like a urinary tract infection. By staying informed, spotting the signs early, and seeking help quickly, you can literally bring someone back to themselves, restoring their clarity, confidence, and quality of life. If this video opened your eyes, or helped you better understand a loved one's behavior, please share it. You might help another family avoid unnecessary heartbreak. And don't forget to like, subscribe, and click the bell so you never miss more life-saving health insights like this. Thanks for watching, and remember, your awareness could save a life. Stay informed, stay connected, and take care of the ones who took care of you.